Welcome back to the Aberdeen Audiology YouTube channel. I hope you're finding these videos useful. Today, we're going to talk about some misconceptions and myths about tinnitus. I'm Dr. Tom Goyne. This is Dr. Alex Taylor. Aberdeen Audiology has offices in Wayne and Westchester, Pennsylvania. And so really, if you're anywhere in the state of Pennsylvania, we can help you through telehealth or in our offices. So we'd love to hear from you if you're having some issues, and hopefully you're finding these videos useful, as I said. So let's get into it. There are, as audiologists, when we are working with people who have issues with tinnitus, some of the same myths and misconceptions come up time and time again. And so Dr. Taylor and I, we narrowed it down to 4 of them, and we're going to go through them now. So the first one is, and we didn't necessarily order them in the frequency that we hear these things, but this probably is the most frequent one, which is,
yes,
there's nothing you can do about tinnitus. You just need to learn to live with it. Now,
so
I know
false.
how I usually tackle that, but how do you tackle it, Dr. Taylor?
Yeah, no. So the reality is that there are tons of things that patients can do to lower the severity of tinnitus. So a lot of these are management options. They're not cure-alls. Okay. So there's a cumulative effect. So let's say I do a tinnitus consultation with you. I may give you 5 to 7 things to implement in your life. Let's say you take 2 to 3 of them. You're likely going to see at least a small dip in the perception of your tinnitus. So I just quickly want to list off a few things that typically we go over with patients. So one, that could be sound therapy. That's an on-ear sound generator trying to lower that percept of tinnitus. 2, hearing aids, especially if you also have hearing loss. Obviously, that's going to help. 3, cognitive behavioral therapy. So that's working with a therapist, working around some of those maladaptive thoughts like tinnitus is ruining my life, or gosh, I'm never going to be able to get out with my friends again because I can't concentrate on what everybody's saying. My tinnitus is so debilitating. So working with a therapist to rewire some of those thoughts is of course helpful. 4, relaxation exercises. So this is going to be different for everybody. So everyone relaxes different ways. This is essentially stress management and how you self-soothe. So this could be a quick walk outside, deep breathing, meditation, etc. And then the last thing I typically go over with patients are diet modifications. So the first thing I always go into is alcohol, sodium, and caffeine consumption, which can all exacerbate tinnitus. So to summarize, yes, there are tons of things you can do to manage your tinnitus. Cumulatively, these should have an impact.
Right. Yeah. I might summarize your summary even more. I mean, I say to folks, you're going to hear, you just need to learn how to live with it. And you kind of do, but the difference is we help you figure out the tools and the tricks and the hacks you can use in order to learn to live with it. Because again, as we've talked about in other videos, it's kind of rare that we can make tinnitus go away entirely. What we usually do
Correct.
is make it way less noticeable, way less bothersome. And so, yeah, we kind of help you find the ways to do that. So yes, you're learning
Exactly.
to live with it, but it's not because you're just going home and just squinting and just
In a state
trying
of
to learn to
hopelessness.
live. Yeah, trying to
Yeah,
learn to live with it. Yeah,
absolutely not.
there's
Absolutely
tools
not.
and tricks. Yep, that's a good one. Another one we run into quite often is that tinnitus causes hearing loss. I've had patients say to me, I feel like I can't hear very well, and it's because of the ringing.
Yeah.
So I know what I say, but how do you approach that topic with people?
Yep. And so typically it's the other way around, right? Tinnitus is secondary to hearing loss. They're very closely linked. So virtually anything that causes hearing loss can also cause tinnitus. It's damage to the different parts of the auditory pathway. This could be noise exposure is a big one, aging, head trauma, etc. But no, typically tinnitus is secondary to hearing loss. Yeah.
Right, right. And as we've talked about in other videos, even a little bit of hearing loss, or I shouldn't even say hearing loss, even a little bit of a change in hearing
From baseline. Yeah.
from baseline can end up causing tinnitus. So maybe somebody goes from, super normal, really good elite hearing to above average hearing. That's still a decline for them, and so it is possible that some tinnitus could develop from that.
That's
So,
right.
so yeah, that's a good one. Another one that we hear from time to time is, well, tinnitus that only affects the elderly, and so then
Yep.
they'll sort of brush it off for people who aren't elderly.
Right.
So, how do you handle that one?
Yep. So that's also false. So tinnitus is known to affect people of all ages. Personally, in clinic, I've had patients as young as 10, 11, 12 come in with a primary complaint of tinnitus. Now, typically, those younger folks aren't as bothered as some of the elderly folks with their tinnitus. But what we do know is that the ones that are really bothered, those kids, can suffer the same way as adults. So they're showing just the same amount of concern for their emotional health, their sleep health, and overall hearing health in general.
Right.
Yeah.
Yeah. Yep. I mean, honestly, I feel like this is purely anecdotal. I don't have any research to back this up. Everybody on YouTube, but uh, you know, I feel like the vast majority of folks that we see with tinnitus are really more in their 30s, 40s, and 50s. Really, I feel like it's a little bit of a decline in hearing. Again, maybe not significant hearing loss, but just a little bit of a decline, and then combined with the stresses of adulthood, with
I was just
jobs
about
and
to say.
kids and all that stuff. For me, I feel like we see more folks in their 30s, 40s, and 50s than we see in their 70s and 80s. Really.
Right. Yeah. And especially post pandemic, I mean, COVID
Mhm.
affected tons of people. So, yeah, that does not eliminate those 30 through 50-year-olds out there as well.
Right. Now, for some people who have hearing loss and tinnitus, um, one of the things we sometimes suggest and recommend and try are hearing aids, but that's one of the misconceptions, is that hearing aids can't help tinnitus. And I know, as a clinician, if we go back far enough, and I know it looks like I've only been doing this for about 3 or 4 years, but if we go back far enough, I used to sort of think that, and I would have
Hmm.
patients who, and again, I want to hear how you handle this, but I would have patients who came in for tinnitus. I would test their hearing, I would see hearing loss, and I would say, well, there's only a little bit we can do about the tinnitus, not too much, but you do have hearing loss, and there's something we can do about that. And their spouse would be sitting there raising their hand saying, yes, let's please do something about the hearing loss. And
Mm-hmm.
we would get them set up with hearing aids, and then they would come back in and they would say, well, I'm definitely hearing better, but you know what else? I'm not as bothered by the tinnitus. And
I
that's
love when that
when,
happens.
yeah, and coincidentally for me, that was about the time that a lot of research started to come out
Yeah.
about how we really should be addressing tinnitus, and it was matching up very much with what I was seeing in those cases. So, I very quickly changed my tune on hearing aids and tinnitus. But again, you are our tinnitus specialist at Aberdeen Audiology. So when people bring up that misconception with you, either in the clinic or at parties, how do you handle it?
Parties. Yeah. Well, the very first thing I say is no, hearing aids are one of the most effective forms of treatment for tinnitus. But one thing I'll say is when patients come in, they don't necessarily hear their hearing loss, they hear their tinnitus. So they're coming
Right.
in, oh my gosh, this noise in my head. But we do identify even just a mild hearing loss. Sometimes explaining to them that it's two birds, one stone, these hearing aids are going to help both of these conditions, it's a little more tangible for them. So it kind of lowers that anxiety of, oh gosh, what are we going to do? It's like, well, we can help with the hearing loss. And that also in turn helps with the tinnitus. And not sure how much we want to get into that in this video. Maybe we make another video on detailing that a little bit more. But yes, hearing aids absolutely do help with tinnitus
Yeah.
for sure.
Spoiler alert. I think we'll get into that in another video. Yeah. So yes, but this is great. These are by far the most common things we hear, and it really, one of our goals with this video is to get the information out there that no, these are not true things. There's plenty we can do about it.
Yes.
Um, I'm we talked about these four. I'm going to throw just a little bit of a curveball at you and throw a fifth one in there. Just I'm curious to see what you had to say about it. Um, people will ask me, well, I saw an ad somewhere. It might be online, in a magazine, TV. I've seen one on TV about over-the-counter supplements that can help with tinnitus, and they're
Mm.
specifically geared towards tinnitus and marketed for tinnitus. Has there been anything, to your knowledge, an over-the-counter supplement that can help with tinnitus?
Nope. Unfortunately, no. Yeah,
No.
that's just NO period. Be very weary of any product, any type of drug out there that's tinnitus cure all, tinnitus be gone. No, unfortunately, there's no FDA approved drug for
Yeah.
tinnitus specifically.
Right. I mean, to my knowledge, there's been no study that rises above the level of a placebo. So,
Correct.
yeah, it would be great. I mean, I'm rooting for, the pharmaceutical industry to come up with something that would do it. But knowing how tinnitus works and knowing what's out there now, yeah, there's just,
And unfortunately, I
unfortunately,
think
there's
that
nothing.
does get a lot of people because sometimes tinnitus, I mean, patients are so desperate for help that they're willing to spend money on that. And it's really, really sad. So if you're suffering or you know somebody that's suffering, please tell them to see an audiologist before spending any money on any supplement. We can more likely help you with at least part of your tinnitus suffering. So please, please do not buy those products.
Right. Yeah, for sure. So again, for those of you watching, I hope you found this useful. If you're in the Pennsylvania area, Philadelphia area, we would love to be able to help you. But even if you're not and you've stumbled across this video, hopefully this gives you some information that you can take to an audiologist and have a conversation with your local audiologist about it, and get some treatment for tinnitus. There's definitely things we can do about it out there, and there's a lot of misconceptions. And
Yes.
so you can get some help if you need it. So
Great.
thank you very much, and look forward to other videos in this channel.